always hear about.
Called bacillus anthracis. It is a disease that affects cattle, sheep, goats, horses, wildlife, and human beings. It is a disease that is a very big challenge to livestock industry and also humans, because we have about 1.1 billion livestock that are actually in areas where this organism exists, that is bacillus anthracis, and about 1.68 billion people living in those areas, while about 68 million animals or livestock are at risk in these areas. So it's a serious disease that requires adequate and prompt attention by all and sundry.
Okay, so how dangerous is anthrax?
Well, dangerous in the sense that it is a disease that affects humans. We have what we call zoonotic diseases, and anthrax is one of them. And unfortunately, it is one of the neglected zoonotic diseases. We have 8 in number. We have anthrax, we have bovine tuberculosis, we have brucellosis, we have leishmaniasis, we also have African horse sickness, and rabies. These are diseases that are neglected because they are not only in rural areas and also in developing countries, but at the same time they are given the opportunity to survive, that is the organism to survive, because of the conditions where these animals exist. So for this organism to actually exist, it provides opportunities of itself to get people infected.
Okay.
So people can just get infected, and it's a serious disease, so that once treatment is not done at appropriate time, death is inevitable.
Okay. So do we have a reason to worry in Nigeria about anthrax?
Well, we have serious reasons to worry, because we are in a country where even disease reporting is not adequately done. Disease surveillance is also not taken very with the seriousness it deserves, though we have seen some level of improvement. So because of our interaction with our livestock, it is important that we take disease to be a very serious one, because there are many instances where you can get this disease either through contact with animals, through soil, even through the meat we consume in the abattoir, or the interactions we have through spores. This is actually why it is very serious, because it's a disease that can be divided into various forms. We have what we call the cutaneous form that affects the skin. We have the gastrointestinal form, which you can get through eating of contaminated materials. These can also be divided into pharyngeal and gastrointestinal, where the larynx, that is where your respiratory system is, and it gets it affected. We also have the inhalational form, and which you now inhale spores of this organism, and once it gets to that, there is every chance that one will have some respiratory problems, including dyspnea and fever, development of some stiffness of the neck, at the same time also edema, and then eventual death if action is not being taken.
Okay. Doctor, you have mentioned some of the symptoms, but I would like you to shed more light on the causes and mode of transmission.
Yeah, most of the mode of transmission involve on the case of animals, the soil is the primary source of infection, because it can survive in the soil for almost 10 years. In some instances, in some cities, has been reported to survive in some areas of up to 70 years. So once the vegetation there is contaminated through the soil, and the pasture there is being consumed by these animals, and it gets to where they are going to even drink water, there is every likelihood that once other animals comes into that place, they get infected through the consumption of such vegetations, at the same time the consumption of such water. From there, you can also get the infection when humans have interactions with these animals, even through the spores that you hardly at times see. You inhale them, and it gets into your lungs, and you will now start developing some problems. Unfortunately, some of these diseases mimic malaria or typhoid, so unless when you have proper diagnosis, you're not likely going to be treated as you should be, because of lack of either the experience or lack of diagnostic resources. You can also get this disease through consumption of contaminated meat, at the same time other products of animals, or even through the wool, that is the skin of the animal. And that's why it is also at times called wool sorter's disease. In the process of the hides and skin, there is likelihood you can get the cutaneous form of anthrax because of your interaction with the infected skin. Or bone meal, that is the one you use in making feed. This can also be a source of infection, and that's why it's like an occupational disease, even though other livestock workers at the same time, other human beings are also at risk.
Okay, can a person infected with anthrax survive?
Yeah, he can survive if adequate attention is given. We have some drugs of choice once you have the disease. We have the penicillins, the oxytetracyclines, the citromycin. These are the major drugs of choice. But if adequate care is not taken, one is likely going to die, because before you said that you start exhibiting certain clinical signs. Actually, the incubation period is about 1 to 20 days. That is for you to start seeing clinical signs. It may appear between those the period I've mentioned. But the implication is that once somebody gets an infection or he is sick, the first thing they usually hear is when you go to hospital is that you treat malaria, you treat typhoid. Unfortunately, we have not given adequate attention to other zoonotic diseases. 75% of the infections we have in humans now comes from animal origin. And that is the main importance of giving animal diseases also the required attention they deserve, especially in our various human hospitals and other hospitals, specialists and teaching hospitals, because that's the only way we can be able to make adequate diagnosis, at the same time include them as part of the differentials. Otherwise, we'll just be treating diseases with different drugs, making people becoming resistant to some of these drugs of malaria, typhoid, and other similar malaria or similar fever cases. At the same time, neglecting other diseases and people dying from these diseases, and trying to also make sure that things are not done adequately.
Okay, doctor, how available and affordable is the treatment?
The treatment is available. For instance, in Sokoto State, we have adequate drugs to treat our animals. We try to purchase adequate drugs to ensure that this is done. At the same time, also, we provided all the facilities in terms of provisions of adequate medical personnel, veteran personnel to be at the borders. We have a rapid response team to ensure that we cover the areas, and sometimes securing our own grazing reserves where these animals congregate, and provide all the necessary things that we need in those places.
Okay, so doctor, just briefly, how can we prevent this anthrax?
Well, the first method is for you to ensure that you vaccinate your animals. At the same time, ensure that once your animals are sick, irrespective of the sickness, you call the attention of a veterinarian, so that he is the only person that can adequately diagnose what is actually the problem.
Okay.
Yes.
So we have been talking with Professor Abdulkadir Usman Junaidu, Commissioner of Animal Health and Fisheries here in Sokoto. We thank you so much for being on the show.
You're welcome.
In continuation of efforts to achieve a lasting solution to the security challenges in Zamfara State, heads of security agencies in the state have ushered in the new year with a peace-building engagement in Shinkafi Emirate. The meeting held at the Emir's Palace was attended by representatives of all stakeholders in the peace process. Salamatu Umar has the report.
The meeting is a follow-up to a series of peace-building engagements already started under the leadership of the Zamfara State Commissioner of Police, with a view to consolidating on the success so far recorded by the peace initiative. Participants at the meeting include representatives of Hausa Fulani communities as well as religious and traditional leaders. The deliberations largely centered on some grievances occasioned by the recent cases of farmers-herders conflicts in the area. Representatives of the warring parties were given equal opportunity to voice out their grievances and to lodge complaints to the peace committee, while farmers accused the Fulani herders of encroaching their farmlands. The Fulani said the government is yet to provide them with dams as part of the terms and conditions of the peace accord.
People freely express their grievances, and those grievances will be taken to the appropriate authority for redress.
The special advisor to Zamfara State Governor on conflict conflicts resolution, Alhaji Abdurrahman Bala said the state government is committed to address all the lingering issues and charged people in the area to remain supportive of the peace initiative. Earlier, the Emir of Shinkafi, Alhaji Muhammad Makwashi Isa, spoke on the positive impacts of the peace accord in the emirate and assured that all traditional rulers in his domain will continue to champion the cause of consolidating on the feats achieved so far. From Gusau, Salamat Umar Abdullahi, NTA News.
Based on Panorama this afternoon, thanks for staying with us. Good afternoon. Good afternoon.